curiosity. That is, I don't know, that is just really great. And this brings up, and again, my mind's going on so many different questions, but I'm going to ask them because we have time. So you bring up the point about patient-centered communication, which obviously you have been at the forefront of this. My thing is, interested, I feel like, and you all have done such good work at the UW of coming up with observation forums and evolving them. I don't even know what my mind's trying to ask. I think it's almost kind of like, how was that process for you all? Like, how was it difficult coming up with like how we going to objectively defined and operationalize what patient-centered communication is? Like, was that a difficult process for you all? What was that like?
Well, it actually, I mean, this comes back to curiosity. Back in the early 2000s, it became apparent to me that there are a lot of things that we need to blend into the skills that we teach primary care providers, not only how to effectively help patients be heard, but also how to manage time so that they can do it in a way without their own anxiety, the clinician anxiety getting in the way because they're in the time. So I've always been interested in that, but there's a huge literature on communication skills that has been studied and documented since, way back when, the 60s and 70s. And I was fortunate enough in the early 2000s to join with a variety of folks, mostly from the Society of Teachers of Family Medicine, who were part of a group called the Group on Doctor-Patient Interaction. And we got together and we organized a way to study all of the major healthcare assessment forms. And we published a paper in 2005, which reviewed all of those forms. And it became obvious. So I learned a tremendous amount from doing that, as well as, having reviewed the literature. It became obvious to me that there were certain things that that if combined in one single form could make a difference. And some of it had to do with some system assessment, but a lot of it has to do with understanding efficiency and how to organize time and make the best use of time. And so we developed the patient-centered observation form, and it's gone through many iterations, and now is very broadly used, I think, in family medicine. So the answer to your question is, it's studying the literature, it's closely studying existing forms, it's coming up with a new model which builds on the existing work that other people have done. And that's always the way it is, right? Nobody has an original contribution. It's always on the shoulders of other people.
For those, again, that are watching, if you're not familiar with the patient-centered observation form, you can access it and the one thing that I really like, Larry, that your team has done is that not only have you developed it for, primary care providers and clinicians, but for MAs, for nurses, like really expanding this to what you were saying at the beginning, where this is a team. This is a team that is doing patient-centered communication. So that it is really and you have videos on it. It just, I don't know, you all did a great job with it. I know, obviously, our residency has used it for years, but hold on real quick. I'm being interrupted by Bridget, who is interrupting a PCBH corner right now, huh? Getting headphones.